Welcome to the DocTalks Podcast. I'm your host, Mandi Fields. I'm here to ask medical experts the questions you might have about diseases and conditions, from heart health to dementia and everything in between. Join me for a conversation where we get right to the points you need to know to navigate Canadian medicine and hospital healthcare. Hi, I'm Mandi Fields, and welcome to the DocTalks Podcast, brought to you by St. Joseph's Healthcare London. Today, we're back with another episode of Patient Talks, the spinoff of our show focusing on the patient experience of the healthcare topics important to our listeners. Continuing on the topic of breast cancer, today we're joined by Deb Jazey to talk about lymphedema, a chronic condition that develops when the lymphatic system is damaged and is most often associated with swelling in the arm after breast cancer. Deb was diagnosed with breast cancer in 2012 after finding a depression in her right breast while on vacation. She was diagnosed in Florida while on her trip and returned to Canada for confirmation and to begin treatment. Now, 13 years breast cancer free, Deb lives with lymphedema and shares her journey to raise awareness and help others living with this long-term impact of cancer. Deb, reading your bio, I also see that you have been married for 47 years, you have 3 children, and 5 grandchildren, and you love to travel. So honestly, my first question is, where do you like to travel?
There isn't a place that we don't like to travel. We're avid travelers. We've been to Australia 5 times. We've been to New Zealand. We've been to Turkey. My husband's traveled in Asia. I haven't been to Asia, but Europe, we like wine. We've done wine tours. We've done cruises. We've been to the Arctic. I've actually done a polar bear plunge in the Arctic Ocean. And this year, we're trying to decide whether or not to go to the Galapagos Islands or Zanzibar. So that will be where we're going this winter, or this coming winter, for our vacation.
Wow, that sounds incredible. I'm so happy to read that you have these opportunities, because it does certainly sound like you've had quite the journey. And so why don't we get into it? Deb, can you share your breast cancer journey with us? When were you diagnosed, and what was your care experience?
Okay, so my breast cancer experience actually started in May or April 2010, and I had quite an intense jabbing pain in my right armpit. So I went to my family doctor. He gave me a requisition for a mammogram, which I had. And both my doctor and myself were sent a letter stating that all was good. See you in 2 years. So everyone in my family breathed a sigh of relief, and off we went on our merry lives. In January 2012, about 18 months later, I was in the shower, and normally I take baths, but I was in the shower and I just happened to lift my arm up and I noticed a large dent in my right breast, and I put my arm down, it disappeared. Put my arm up again, there it was. Put my arm down, I thought, what is that? So I'm very adept at using the internet, and it turned out it was like one thing, breast cancer. And I thought, what the heck? So I called, we were staying in Florida for the winter, and so I had called the local mammogram center in Venice, Florida, and they said I needed my 2010 mammogram and a requisition from my doctor. So I called the London doctor. They called me back and said, your 2010 mammogram is nowhere to be found. The clinic in Venice was a little disappointed with that, but they still did the mammogram. They confirmed with the mammogram that there was something going on, and I had an ultrasound. And then the actual radiologist came out and said, I don't usually talk to patients, but he said, you're from Canada. And he said, you have to get home now or be treated here immediately. And it was like, what? And so anyway, that's how my breast cancer journey started. It took us a couple of days to get my head around it and pack up the house. And I think I went home and grabbed a bottle of champagne and went into the pool and floated around for a while trying to get my head around it. And then finally, that was on a Friday. Sunday morning, we headed back to London. I was able to get a bone scan. I was able to get into the breast care clinic very quickly, and they confirmed everything that the doctor in Venice had said. And I started on my way. One of the things that they noticed as well is that they had access to that 2010 mammogram. And the radiologist, when she was doing my biopsy, said, that this was diagnosed in 2010. And I said, no. I said, I have a letter that says I was fine. She said, no, it was circled for follow-up. So that was surprising. So in 2010, I already had cancer cells in my lymph nodes. And that was the start of my experience with breast cancer.
Did that knock you over when you heard that?
I was devastated. You just wonder, you trust the medical system. And I knew there was something wrong. And I felt relieved when they told me there wasn't, but that was still in the back of my mind because I still had that pain and it was increasing over that time. And what was even more upsetting is I did everything they said. I opted for a lumpectomy and I had a fabulous surgeon. So it was just wonderful. But he said to me, what do you want, a lumpectomy or a mastectomy? And I said, what's the difference? And he said, nothing as far as longevity, which that kind of surprised me. I thought that if you had a mastectomy, you could maybe live longer, but that wasn't the case. So I opted for breast preserving surgery, but I ended up having to have 2 surgeries to have clear margins. So that was fine. And then I met with the medical oncologist and the radiation oncologist. I was having 8 dose-dense treatments.
What does that mean?
Okay, dose-dense is doxorubicin and cyclophosphamide, which are 2 of the stronger. It's usually used for aggressive breast cancer. It's given once every 2 weeks. They call the doxorubicin the red devil. It's not very nice. I had 8 chemos and 4 of the dose-dense doxorubicin and cyclophosphamide, and I had 4 Taxols, which is another type of chemo. That was every 2 weeks.
Every 2 weeks? And then is that 2013 still, Deb?
That was 2012. I started May 1st, 2012. So I went to the end of August with chemo, and then I had a short break, and then I started my 30 radiations in, I think it was the first part of October.
And then with your treatment, when did this turn into lymphedema?
When I started my chemo, I basically thought I was going to die. So I said to my oncologist, am I safe to book a trip at the end of my chemo? Will I be well enough to travel? And she said, oh, yeah, sure. So I booked a trip for my husband and I. We went to Sandals on Great Exuma Island, and it was very hot, very humid. And as I turned around to put something in the dresser, I banged the top of my hand on the dresser, and my hand blew up like a cartoon. Like it was just an atrocious size. And I thought, are you kidding me? And I tried everything. It wouldn't go down. I thought, the humidity and everything. And it bothered me the entire time we were away, so that I was actually too sick to even enjoy the time that we were away. I got back to London and I couldn't find anybody to treat me, like a specialist. I could not find anybody. Actually, when I got back to London, the first thing I did is I went to the breast care clinic and I said, look, I know this is probably lymphedema. This is not right. Like what's going on here? And I talked to the nurse practitioner. What I found back then is there wasn't much material available at the breast care clinic. She had a pamphlet, but it was only one. So she photocopied it for me and gave me a list of practitioners that could possibly help me out. The first practitioner I called said, are you through your treatment? And I said, no. And she said, well, I can't touch you because until you're through your treatment, if you have any cancer in your body, by us manipulating the lymphatic fluid, we potentially could spread it.
Oh, wow.
I said, whatever, I can't live with this hand. I mean, you have no idea what it looked like. And I had it in my arm as well, but it was my hand that blew up first. Mm-hmm. So anyway, my daughter was talking to a friend of hers and said she knows somebody that would do it. And I actually found somebody who would do the lymphatic massage. And as soon as they put their hands to me, it just went pop and the fluid was gone. And I thought, thank goodness. So anyway, I had some swelling. When I said gone, it's hard to realize. I didn't realize, but looking back on it, I did have swelling. If I look down at my 2 arms, even now, they don't look too different from each other. But when I put my arms up, let's say you put them up like a blocking measure in front of your face, there's a huge difference in the forearm. But you just can't, I guess I'm living, you look at it from when your arms are down, you go, it's not too bad. When you put them up in front of the mirror, you can see the absolute swelling in your arm.
Is it sore right now, Deb?
No, I keep compression garments on it. The big thing with lymphedema is you have to identify it immediately. And that's what I did. Unfortunately, though, the standard of care with the people, the specialists that treat lymphedema, which are either physios or RMTs, they have a special designation. They do special training, and the training is called complex decongestive therapy. So it's not a case of just somebody rubbing your arm. They have to find the pathways that are plugged and the pathways that are open. And they have to move that lymphatic fluid from the tips of your finger up your arm into a pathway that will take it into lymph nodes that are working. In my case, I had 2 breast surgeries to get clear margins, but I also didn't mention a very important thing. I had all of my lymph nodes removed in my right axilla. I had a radical surgery. And as I mentioned to you earlier, the cancer was found, or there was something suspicious. The first mammogram in 2010 apparently did not show anything in my breast, but it showed something suspicious in my armpit, which is where I was having the pain. And that's what was circled for follow-up. Well, by the time 2012 came and they actually did a biopsy of the armpit before the surgery, it was confirmed I actually had a tumor, a cancerous tumor in my armpit. So it had already basically metastasized to my lymph nodes. So they got rid of all those. That made it a little more complicated and almost guaranteed me that I was going to have lymphedema. I also, when I came home from the hospital, I had a drain in my side to take the lymphatic fluid out because it had nowhere to go after that surgical procedure.
And before this happened, before you were diagnosed with lymphedema, had you ever heard of this before? Like, had anyone in your life ever experienced this? So you had a bit of a blueprint?
No, our family is not a cancer family. We don't have cancer in the family. I was the first and only of all the decades of people that, especially breast cancer, there'd been no one with breast cancer. One of my friends had breast cancer, but she didn't have lymphedema. I probably now have 4 friends with breast cancer, and they all caught it early, which mine could have been, but wasn't. And as a result, it had progressed to the point where I did have to have that axilla dissection. And as a result, I ended up, it was probably, my chances of having it were probably 100% for sure after the surgery.
And for our listeners at home and people who are listening because they're on the journey or a loved one is, this word axilla, you've said it a few times. I don't know what it is. And I'm thinking maybe others don't. Can you explain that?
Okay, it's axilla. It's the armpit. I guess it's another word for armpit. AXILLA.
So lots of doctors will know what this word is. So
yes.
I have a sociology degree. Okay, I've just said it. It's out there right now.
Yeah.
So, okay.
Yeah, they called it a axilla dissection. So it was a new word to me as well, Mandi, so don't feel bad.
Okay, thank you for clarifying. So now, Deb, how does it physically feel like when it flares up? Do you live in chronic pain, pressure? Walk us through.
It can be all of the above. Luckily, the lady that I first went to who refused to treat me back in 2012 when I got back from Great Exuma, she is now my full-time person, and she's probably the best in London, and she's just wonderful. That's her specialty. She's a physiotherapist specializing. She's got her CBT, and she specializes in lymphedema only. She does arms and legs. What her big concern and her thing that she stresses is as soon as you know you have it, you have to be seeking treatment. Now, I knew I had it, but as I said before, there is some thought that if you're moving lymphatic fluid around, if there is active cancer, they don't want to treat it until you're done your treatment. So the minute I finished my treatment, I went to see her and she took me as a patient. At that point, she was able to get rid of all the swelling or the majority of it. I still wore a compression garment if I was outside, if I was doing anything in the garden, if I was stirring anything that required me to move that arm could potentially cause swelling. When it does swell, if you don't deal with the swelling, you feel like you're carrying heavy weights around with you. Sometimes the fluid will build up and it will go into your breast and your breast will get hard. Sometimes it will go into a pocket right at the back near your armpit and that will get hard and it hurts. It's not a nice pain to have, but the minute that you are able to relieve it with a massage, that works out well. I've been going to see her. When I first started seeing her, it was only maybe once a month because it was minimal swelling. After that initial swell with my hand, it was minimal swelling for the longest time. And I wore the sleeve and I was really good. Then at one time I had an injury to my arm. All you have to do is bang it or have a bug bite or just anything like that can set it off. Then I was having to go see, I was almost at her place in 2022, my oncology doctor changed my medication for I have lymphoma. I have a lot of lymphs. I have lymphedema and lymphoma, but I have lymphoma, and he changed my medicine. And for whatever reason, that medicine seemed to go after that arm. That arm bruised and started to swell up. So my lymphedema was kind of under control, like reasonably manageable for basically 10 years. And then this drug, my arm turned black, the forearm, and it started to swell. And the doctor said, that can't be the drug. What did you do? You must have hit it. I said, I know what I did. This is nothing. As soon as they took me off the drug, the bleeding stopped.
And did you know it was drug related? Like, did you have a gut instinct?
I knew that I didn't hit it. And I knew that shortly after, about 4 weeks after I started to take this drug, I started to see bruising and then actual big spots. And the oncologist had a lot of pushback on that because he said, well, you must have done something. I said, I haven't done anything. I said, listen, this is because of the drug. And I said, I want to go off the drug. So he said, okay, well, we'll try you and we'll take you off the drug. As soon as he took me off the drug, it went away. Wow. But the swelling and the issues that I had with my lymphedema, that was in the summer of 2022. And I'm just now getting it back to the point where it's not as large and as painful as it was.
So Deb, you've had a decade plus of this journey. And I'm wondering about programs that help support the cost of your ongoing care. Like when you go to see this woman, this physiotherapist who has a specialty in lymphedema, is this covered, or what programs are out there that help you offset the costs?
I have an insurance company that helps pay for my physio, but I have a maximum on that. And once you hit the maximum, then you're on your own. So if you're getting, let's say you have a $1,500 maximum, it's $100 a pop. And if you have a huge flare up and you're going 2-3 times a week for a few months, it doesn't take long to eat up that insurance thing. And plus the compression sleeves and the gloves, they're roughly $1,700 each for one set. So ADP covers 75% of that. But
what's ADP?
Assistive Devices Plan. It's a Ontario government plan.
Okay.
And that's another thing. When you are seeking treatment, if you think at all that you might have lymphedema, it's best just to find, I would suggest you go to St. Joe's and get a list of the ADP qualified physios and RMTs, and then they can start the process for you, because the faster you get compression on it, the better the results will be. A lot of people don't have the resources to pay $100 every so often, even once a month for this treatment. So there are some really good internet resources up there, and you just have to know which ones are good. And I was lucky enough, I showed my physio and she said, yep, that's pretty good.
Well, that was one of my questions, was what support or resources have helped you the most, because of the way you're so willing to share your journey. So thank you. Thank you for that, because it will only help others. Who would you recommend? What organizations would you recommend? Would you honestly say YouTube?
Well, first and foremost, for treatment, to be successful, you have to be assessed, because your swelling may not be from lymphedema after your surgery. It could be from a blood clot. So that's imperative that you rule out blood clot. Once you rule out blood clot, then the alternative is lymphedema. And then if you go to CBT, they will start everything for you. That is the person that gets everything going. And then there's 2 places in London you can be fitted for your garments that are covered by ADP. One of them is Yorick on Wellington, and the other one is Guardian Drugs on Dundas Street. And they have specialized people there that measure your arm and order these compression garments. When you have lymphedema, you only have the use of one arm for giving blood, receiving blood, having blood pressures taken. That arm that's involved with lymphedema is off bounds, because even having a blood pressure taken can put too much pressure on the skin and can damage the skin. And you could end up with a flare up. A bug bite can cause a flare up. You have to be careful where you get your nails done. If someone irritates your nail bed or gives you a little cut when they're pushing down your cuticle, if you don't treat that immediately, you could get cellulitis, which could turn into sepsis. It's a very dangerous thing. When I travel, my surgeon, right from the get-go, said, once he found out I had lymphedema, he said, make sure you never go anywhere without antibiotics, because he knew I traveled quite a bit. And I'm also allergic to a lot of the penicillins. So I have to take my own antibiotics with me, because I can't depend on being somewhere and them having the type of drug that I need.
Deb, I'm thinking about you talking about the wrapping of your arm and your fingers, and emotionally for you, being out in public, wearing, these wraps, dealing with the clothes that no longer fit or your jewelry, etc. What's that like emotionally for you? Or is it just the new you? This is just part of who you are now.
Again, we're going back 13 years, as you know. I'm a very proud person. I like to dress up. The biggest thing is short sleeves, right? So my compression sleeve comes up basically to just under my armpit, and then I have a glove that covers that. So I can wear a short sleeve. If we're going out to a formal event, I can wear a black gown with short sleeves, and then I just put the compression sleeve and glove on. And then I have a lot of really fantastic shawls and little shrugs that I can put on that just kind of cover it up. I guess I am embarrassed. I mean, it's just the weight, the emotional weight, the physical weight. You want to look good. And it does have an impact on you. The jewelry that I used to wear on that hand, I can't wear, because if I have it on and something happens and I bump my hand, it swells like fast. So you wouldn't even have an opportunity to get the ring off. You'd have to end up having it cut off, or, you could possibly lose your finger. It swells up that quickly. I know that's an exaggeration, but it's just the swelling is intense and it's fast when it goes, and it doesn't take long. One of the 2 things that I've found is people talk about skin care. It's not so much skin care, it's protecting your skin. Like putting lotion on your arm is not going to, if you don't have any symptoms of lymphedema, putting lotion on your arm is not going to keep it away. If you have to put some sort of cream on your arm, it's because your skin is broken down. So it's preventative. If you get a cut, you have to protect it. You have to keep it out of the sun. You can't get a sunburn. My whole life has changed. I was a sun worshiper. I can't do that.
I was going to ask, how has it affected your daily life?
We have a swim spa. I swim every day. I have to wear a rash guard, like a suit. I keep everything covered. If it gets hot, it will still swell up. Now, that's 2 hours of exercise. Swimming, they say, is one of the best exercises for lymphedema, but it wasn't doing me, it didn't work. Like here I was doing 2 hours because I was carrying some weight left over from the cancer treatment. When I first was diagnosed with cancer, when I went to see my medical oncologist, I said, hey, well, I try to always look at the good things. I said, well, at least I'm going to lose weight with breast cancer. And she said, Deb, I'm sorry, but you're going to gain weight with breast cancer. And I gained, I would say, probably 15 to 20 pounds with it. And it took a long time to get it off. And even though I exercised, it didn't seem to help. Well, maybe it did. I just wasn't getting any worse.
Did they explain why you would gain weight with breast cancer?
Because my cancer was estrogen fed. And so they have to shut the estrogen down, it's like going through menopause.
I see.
When you shut that down, I guess you gain weight.
Got it. Okay.
But now I've been exercising like a fiend. I'm on a diet regime and I've lost the weight. And my lymphedema is more under control than it has been since pre-2022. And I attribute a lot of it to the weight loss.
Well, congratulations to you for being in tune with your body and figuring that out.
Well, it's that or sit back and do nothing. And I'm not a nothing person. I'm always trying to improve what's going. I look better now than I did 20 years ago. So I feel good and enjoying life.
Deb, that puts a huge smile on my face listening to you say that, because when I talking to you for the last 45 minutes, like, wow, you've had a real journey here. This is not something to take lightly. And so do you have advice for others who are newly diagnosed with lymphedema?
Well, the big thing is it can come anytime after cancer. If you have surgery and you have radiation, you just don't know. As I said, I think mine was exacerbated initially with that bang and the humidity of being in the tropics right after. Well, technically, I had surgeries in February and March of 2012, and then chemo from May to August. And I banged that hand and it puffed up like crazy. Once I got that under control, it was not too bad. But you can't prevent lymphedema. What you can do is lower your risk. And you lower your risk by just being aware of the potential that you could have lymphedema arise. You have to just be so careful about with that arm, banging it and everything else. But the big thing, and I can't stress this enough, is you have to, the minute you have any swelling at all, you have to get in, you have to be assessed, someone to confirm it's lymphedema, and then get on with it. Get compression sleeves on if you need wrapping. There's other things. They have electronic pumps. I never resorted to that, but there's just so many pieces of foam and sponge and tape and everything out there that you can use to reduce the swelling. And again, the massage draining. I was having it so often, and my husband came in and my physiotherapist recommended that he be trained. So she spent a good hour with him, showing him how to do lymphatic drainage. She showed him certain moves. Now, that's not all the moves, and sometimes it didn't work, and I had to go to her in between. But he still, after all these years, still gives me some drainage. And if you'd ever seen one, it's amazing, because my hand can be really swollen, and then he starts, and then once he's done the maneuvers that he has to do, you can actually watch the fluid drain out of your hand. It wrinkles right up, and it's pretty amazing, the whole process.
And does it just drain, the fluid just drain back into your body?
It finds a path, like you're able to direct it. You keep it away. As I said, I have no lymph nodes in my armpit. So we have to get it to either down into my groin. So you can pull it down into the groin. You can pull it into the other lymph nodes. You can pull it up to the lymph nodes in your neck. Sometimes you go around your back and down to your lymph nodes around the back there. I've never been much for anatomy or never wanted to be a nurse and things like that. So watching this lymphatic fluid drain out of my hand or out of my arm in a short period of time, it's pretty amazing. So, but what happens if you let that stay? That lymphatic fluid, it has a high protein content to it, apparently, from what I understand, what I've been told. And it will almost solidify in your arm. So you get to the point where it's really hard. Like, we're not talking stone, but well, your arm can feel like stone. And it takes a lot of manipulation to break that up and get it moving again. If you don't treat it, your arm will get heavy and it'll feel like a piece of stone. That's how hard it gets. Same with your breast. Like I mentioned before, sometimes my breast just gets like a rock. It's not a good thing.
I haven't heard of lymphedema really. And my mother passed when she was 46 years old of leukemia. And I've had my own small teensy weensy journey with breast cancer with a lumpectomy and it coming back benign. But talking to you and listening about lymphedema, I feel like we don't know very much about it. And I feel like I need to have more compassion when somebody says it to me, because I've heard of it, but I don't know anything about it.
Well, again, since I was in the same boat, Mandi, and then traveling around every now and again, I will see this woman with this great big arm. And I want to go up to her and say, you don't have to have that big arm. Some people are not even aware of the resources. It's the cost. It's the time. I'm just able recently to get oven gloves on. Imagine that. I have the really good silicone ones that come up and protect your arm, but my arm was so swollen, I could get my hand in, but my forearm, I couldn't get the glove up. So I had to buy a different pair of oven gloves that were actually more dangerous because I want to keep everything covered when I'm working around the oven. You certainly don't want to burn on that arm. And it's just the little things like that. I had beautiful clothes with long sleeves, but the sleeves were narrow, like regular size. So I couldn't get my arm in.
Have you ever thought about being a lymphedema navigator,
I
Deb?
would love to do that. I've always wanted to find a way to help the people because, as I said, the ADP program covers compression garments, even if some of these people that were covered and could afford to buy them, and they get new ones all the time, even if there was a bank where you could donate those used garments because they don't wear out in 3 months. Your arm could change size, but then you could give them to people to put these, even some compression, even if it wasn't 100% right, it's still better than no compression.
Well, thank you, Deb. Thank you for joining us today and for sharing your story with our listeners. Thank you for your honesty, your candor, your emotions. That's how people will connect, and it helps us to feel not alone. So thank you for that. That's it for this episode. If you're interested in hearing more, join us for our next episode of DocTalks, and be sure to follow us on Facebook, Instagram, and LinkedIn at St. Joseph's London. And you can visit the St. Joseph's website for more information on breast cancer treatment. Until then, stay healthy.